Welcome to this week's edition of Cardiovascular Updates, covering the latest breakthroughs. Brought to you by Lucid Quest, a digital heart health program is making waves for women in menopause. In a study of over 48,000 participants, the Hello Heart program was linked to significant blood pressure reductions, especially in women with hypertension. The program combines a connected blood pressure monitor, AI coaching, and menopause-specific heart health content. Women showed greater improvements than men over 12 months. At Johns Hopkins, researchers have developed a new AI tool to predict sudden cardiac arrest in high-risk patients. The Mars deep learning model analyzes medical records, imaging, and MRI scans in individuals with hypertrophic cardiomyopathy. With up to 89% accuracy, it outperforms existing clinical risk tools and identifies hidden scarring patterns associated with lethal arrhythmias. A wearable device from Neubond is bringing hope to stroke survivors. This bracelet detects movement intention and stimulates muscles to reinforce neural pathways. Early trials have shown improved coordination, strength, and daily living skills. The company is now seeking funding for larger clinical trials and regulatory approval. In interventional cardiology, the first patients have been enrolled in the Magical SV trial. This study will compare a sirolimus-coated balloon to drug-eluting stents for treating small coronary vessels. The trial aims to recruit 1,605 patients across the U.S. and Europe, potentially offering a metal-free PCI strategy for complex small vessel disease. From Japan, registry data support the use of transcatheter edge-to-edge repair, or TEER, in patients with atrial functional mitral regurgitation. Compared with medical therapy, TEER was linked to a 35% lower risk of death or heart failure hospitalization. This survival benefit was sustained over 3 years and was most pronounced in patients with minimal residual regurgitation, offering a low-risk alternative for elderly patients not eligible for surgery. The shortcut leaflet splitting device has been granted a CMS New Technology Add-on Payment designation. This means hospitals may receive up to $9,750 in additional reimbursement per procedure for valve-in-valve TAVI cases, addressing the challenge of coronary obstruction in complex valve interventions. The Victorion-Intervention trial has launched to evaluate whether twice-yearly inclisiran can reduce cardiac and limb events after revascularization. Targeting 6,000 participants across 250 U.S. sites, the study could shift standard care toward earlier, more aggressive LDL-lowering therapy. A next-generation heart patch known as RC patch may revolutionize heart repair. It combines a sealing mesh, a 3D printed scaffold, and heart cells to heal damaged tissue. Designed to fully degrade as it integrates with heart muscle, early animal studies have shown strong sealing and restoration of cardiac function. On the safety front, new research suggests pregabalin use may increase the risk of heart failure in seniors. In a study of more than 246,000 patients aged 65 to 89, pregabalin was associated with a 48% higher risk of heart failure compared to gabapentin. The findings highlight the importance of cautious prescribing in elderly patients with chronic pain. Finally, artificial heart technology is moving forward at speed. The Bivacor Total Artificial Heart System has been accepted into the FDA's Total Product Lifecycle Advisory Program, or TAP. This magnetically levitated pump is designed for end-stage heart failure patients awaiting transplant and follows the success of the first-in-human implant. Expanded clinical trials are now on the horizon. Stay ahead in cardiovascular research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert healthcare consulting.